Hi, my name is Joselyne Berreta, and I will be validating on setting up an IV piggyback. So first thing I'm going to do is my 7 steps. I will be checking physician's orders. I will be washing my hands, introducing myself to the patient, and identifying the patient. I will be gathering my equipment, which I have, and I will be providing for privacy. And I will also be administering medication, so my 6 rights are right patient, right drug, right route, right time, right dose, and right reason, and documentation. So now that I have that, I will be assessing my patient's IV site, making sure there's no redness, swelling, and the patency of it. I will also be assessing the primary IV bag, making sure the rate flow is correct and there's no punctures or cloudiness. So now I'm going to be setting up my IV piggyback. So I'll be labeling, making sure that everything is okay with the bag, no punctures, no cloudiness, and I'll also be comparing with the MAR and labeling with date, time, and my initials. Same with the tubing. I'll be opening up my tubing. Okay. Making sure, like I said, it's labeled. I'll be keeping it above my waist for sterility. Okay. So now I will be opening my IV bag. And this to spike it. Okay. And now I'll be putting it on my IV pole. So I'm going to be priming it. I'm making sure my chamber is filled halfway. Okay. Since I won't be recapping, I have to keep sterility. And place it. And slowly prime, checking for air bubbles. And only a little to prevent wasting medication. Okay, so it's good. No air bubbles. Okay, and I'll be recapping. Okay, so now I will be setting up my IV bag. Lowering my primary. Okay. And now I have to clean the primary tubing for 15 seconds.
So I'm going to start with my 7 steps. Check physician's orders.
Okay, it's been 15 seconds.
Gather my equipment. Introduce myself. Identify the patient. Explain what we're going to do. And provide privacy. So first I'm going to make sure the patient is comfortable.
Okay.
And I'm going to
Now
prepare my
I'm going to be checking for air bubbles once again, because it is hooked on the IV, the primary IV. Okay. And making sure that it's dripping. Okay. Unclamp the piggyback completely. Making sure it is coming from the piggyback. Yep. Okay. So now this will be inserted into the patient's arm. Because I will adjust the rate of flow to 16 drops per minute, so that would be 4 seconds per 15 seconds. 4 drops per 15 seconds.
You also want to keep in mind that 1 inch around the crystal field is good. I mean outside. So it was considered non-sterile.
Hi, I'm Katie Kim. I'm going to validate secondary bacteria. First of all, I have doctor's order. I washed my hands. I have equipment ready. I introduce myself to the patient. And then check her ID. And then explain the procedure. And then make a privacy. This is medication, so I did it 7 right. Right documentation, right drug.
Okay.
Right,
Again, checking.
right patient, right time. Okay. First of all, I put the bed
When I
off
will,
to my
after
working
washing my hands, I
side.
will assess.
Okay. And that is 4 drops per 15 seconds.
I decide
Clean
where they need red means
Okay.
calling and
Laying this down.
close the area.
Okay, and since that is done, I will be gathering my equipment again, just throwing out, cleaning my area, making sure the patient is comfortable in a low position.
and check the check the
I will be making sure that they have the call bell just in case they need something, and I'll leave the room and wash my hands. And I come back after I check that the medication is complete. I will be
from the
removing the IV piggyback.
To assess for the odor, amount, color.
should be okay.
So after
Placing my primary IV back into its original height.
And then make sure there's a label,
wash my
time,
hands
and
and
initial today.
get my sterile
Clamping
gloves.
my IV piggyback.
The label on time, initial day.
Disconnecting.
You always want to keep in mind too that once you put your gloves,
This would be empty, so I'd be disposing
have
of
to
it.
keep them above your
And I would readjust the primary IV back at its original drop rate. Making sure, once again, just assessing for any redness, swelling, and the patency. And I will be making sure the patient is comfortable in a low position. Making sure they have the call bell if anything. And the railings up, in this case there's the railings. And I would wash my hands and record an INO. And that is my validation on setting up an IV piggyback.